Cervical artificial disc replacements is a newer technique that is being used more and more instead of spinal fusion. It has the same benefits of anterior cervical neck surgery while having an additional benefit of not fusing the spine.
What a lot of patients don't understand, that even though it's a disc replacement, it's actually a prosthesis we put in the neck, but it gives you the same amount of mobility or close to the amount of mobility that a normal disc would have.
So a patient with a herniated disc in the neck that is trying to avoid fusion surgery can still have that herniation addressed while at the same time maintaining the motion of their neck after surgery. So for younger patients who have minimal to mild arthritis, cervical disc replacement may be the best option.
There are strict FDA criteria for an arthroplasty. Now, patients who meet those FDA criteria for the arthroplasties tend to do very well.